Morning, everyone. This is a coronavirus-focused talk, and the reason is our leaders, federally, municipally, provincially, are all ignoring some very, very real, very encouraging data about the coronavirus. Instead, they're saying doom, gloom, and fear. And well, I just want to expose that. I think that I don't think it's appropriate. So here is Ezra Levent, and he's responding to a CBC News article. The CBC News article is from September 22nd. Today is the 24th. And the CBC News article says, Canada is at a crossroads on projected growth of coronavirus. PHAC says modeling suggests number of cases will resurge if current level of contacts maintained. Gray line, increased contacts. Orange line will mean faster resurge, while decreased contacts will flatten the curve. Okay, so we're back to flattening the curve. And it's garbage. Ezra Levent says, you inveterate liars. Theresa Tam's models said we'd have up to 350,000 people dead by now. The real number is 9,000. The models were really wrong. Really wrong. And everything Theresa Tam said was wrong. She said, masks shouldn't be worn for healthy people. Now masks are mandated. Closing borders doesn't work. The virus doesn't know borders. Now borders are closed. Interesting, right? Except unless you're flying here from an infected area. The federal airports are still landing those flights. Here is, on August 6th, the Ontario definition of a positive case of coronavirus changed. I wanted to tell you about that because it could be impacting the number of tests. Maybe, I don't know. I don't know how often these tests are used. And I want to show you that the PCR test that I was telling you about is the one that is used in Ontario. See, confirmed cases, okay? So this is health.gov.on.ca. Link is in the description. You can check it out for yourself. Confirmed case means a person with a laboratory-confirmed SARS-CoV-2 infection using a validated assay consisting of positive nucleic acidic amplification test, NAAT, e.g. a real-time PCR or nucleic acid sequencing on at least one specific genome target. Laboratory confirmation is performed at reference laboratories or non-reference laboratories, or a person with a positive detection of serum plasma immunoglobulin G, IgG antibodies to SARS-CoV-2 from a laboratory in Ontario that is licensed to conduct serology testing for clinical purposes. And see footnote 10, it says, at this time, the COVID-19 IgG license is available in Ontario for serology testing for limited clinical purposes. COVID-19 IgG testing should not be used as an acute screening or diagnostic tool or used to determine a patient's immune status or inefficacy. Results should be interpreted in the context of the clinical and exposure history. So I think that there's flaws with this test. And I think that, well, here's Randy Hiller, and he's using my comparison of the premier has no clothes, the emperor has no clothes, right? Everybody's running around wearing a mask, and the emperor's naked. Like, these things don't work. Why are we doing this? All you have to do is say, you're naked, emperor. You're naked. It doesn't do anything. It's false. It doesn't do anything. Here's Mr. Hiller. And I teased this on my last video, but they shut him down. This is real. This should very much concern you. If you're in Ontario or in Canada, he is not speaking lies or hate speech. He is speaking, as far as I understand it, truth. So here's the tweet, and I'll play the whole video. I think it's a minute long. In the House today, I, Randy Hiller, asked the Premier when he would begin being truthful and honest about the dangers of COVID. In response, I was shut down by the Speaker and snubbed by the Premier. As we can see, no one wants to say the Emperor has no clothes.
The question is for the Premier. It's time that this government begins to be truthful and honest. For 7 months, the public has been fed...
Member will take a seat. I'm going to caution him on his language. I will caution the member on his language that he's going to use. Place your question.
Some real, some probable, and some imaginary. Although the elderly who are sick and frail are at a high risk to COVID, the rest of the population is not. Unlike the repeated messages of panic from this government, we do find clarity in other jurisdictions. Dr. Lawrence Rosenberg, Montreal's medical officer, has stated, and I quote, "This COVID virus is much like the seasonal flu." A group of over 400 Belgian doctors have stated, and I quote, "COVID is not a killer virus, but a treatable condition." 18 Canadian doctors wrote the Premier, and I quote, "Your policies risk significantly harming our children with lifelong consequences." Speaker, to the Premier, will you start being honest about the risk of COVID.
And ask the member to withdraw. Government House Leader to reply.
Thank you, Mr. Speaker. Respectfully, I disagree with just about everything the member said.
Again to the Premier. Our Deputy Chief Medical Officer of Health has stated our testing results are over 50% false positives, yet we keep testing, knowing full well that the results are near meaningless. Another group of Australian doctors have spoken out, and I quote, "Ordinary, sensible people, if properly informed, will inevitably conclude that the government's policies are ill-focused, heavy-handed, and unjustifiable. But your government keeps creating new restrictions." A group of UK doctors have stated, and I quote, "The objective of virus suppression is unfeasible and is leading to harm across all age groups. But the government limits access to our healthcare system, putting everyone at risk." Speaker, I believe that this government has caused enough harms. To the Premier, why are you using COVID as an election campaign strategy at the cost of health, freedom?
Member will take a seat. The next question.
So when you ask questions in the Ontario legislature, they will ignore you, especially as an independent. That happens. But I believe that he was speaking truth and had good points, and I believe those questions deserve answers. Here is, moving on, the CDC. The U.S. government last week updated the survival rates if infected for COVID-19. This is Adam Crichton. He's from Australia. He's a co-host of the Business Weekend, Sky News Australia, if that matters to you. But the source is correct, CDC. If you're 0 to 19, you have a 99.99% survival rate. If you're 24 to 49, you have a 99.98% survival rate. 50 to 69, 99.5. 70 plus, 94.6. What does the flu look like? I'm not going to show you. And I'm just not going to look it up. Here is a reminder that the Toronto Public Health has said publicly and with their Twitter, individuals who have died with COVID-19 but not as a result of COVID-19 are included in the case count for COVID-19 deaths in Toronto. And still, the last death in Toronto was August 28th. And no, this isn't the right one. Hold on. Well, since my last video, they have changed the interface. So this was from the same tweet as from, or the same link I used as from Israel Events. And it used to show a whole interactive graph, and it was on my last COVID thing, and it showed the last death. And there's none of that information there. So they've scrubbed that information. Wonderful. Isn't that good to know? So anyway, the last death was August 28th, and that's incredible. And it's even more incredible that they're hiding that information. So I didn't even realize that. I was just using this to back up what I was saying, that there haven't been many deaths. They're not even counting deaths. Maybe I'm wrong. If you know where that chart that I was using the other day, this is the same link, so it should be here, but it's not here. So, but they're not even showing deaths. Where's the deaths? Where's the fancy chart that I was using? Those snakes. Okay, moving on. A group of us across medicine, academia, and other areas have come together and sent this letter to the Prime Minister. This is British. Professor Hennigan, Gupta, and many others, a wide range of voices as this crisis affects everything. We desperately need a rethink to find a better balance. And this is Professor Carol Sikora, and he's an oncologist for 50 years, CMO of Rutherford HPLC, founding dean and professor of medicine at UOB Medicine, ex-director of the WHO Cancer Program. Okay, so this guy's got a bit of clout. And the letter basically says, in summary, our view is that the existing policy path is inconsistent with the known risk profile of COVID-19 and should be reconsidered. The unstated objective currently appears to be one of suppression of the virus until such a time that a vaccine can be deployed. This objective is increasingly unfeasible, notwithstanding our more specific concerns regarding existing policies, and is leading to significant harm across all age groups, which likely offsets any benefits. Instead, more targeted measures that protect the most vulnerable from COVID while not adversely impacting those not at risk are more supportable. Supportable. Given the high proportion of COVID deaths in care homes, these should be a priority. Such targeted measures should be explored as a matter of urgency as the logical cornerstone of our future strategy. So they're saying your current strategy is not working and we need to change it because your current strategy is for something that's much more deadly than what we're dealing with. Here is Deputy Prime Minister Freeland. Here we go.
Everyone, let's flatten the curve together, limit our social interactions. Please let us all wear our masks. If we do it right, we can avoid having to do much more terrible things, and we can let our kids keep going to school.
Much more terrible things. What more terrible things, Deputy Prime Minister, Finance Minister? What terrible things. Terrible things like having to watch you go through another makeover. Honestly, like there's a lot of makeup there. That's a lot of. You guys ever see, what was that movie with Sandra Bullock? And they said, oh, there's a lot of work. And then she's all ugly and geeky. And then she comes out all, right? Like it's the same thing. And they joke and they have a jackhammer, right? I'd love to see the montage. I'd love to see the montage. I don't want to see that. But terrible things? Wear our masks? The masks don't do anything. They didn't do anything. Here's extreme lockdown versus no lockdown. New York State versus Sweden. Why? Why is our government refusing to pay any attention to this? Kulvinder Kaur, she's a doctor. She says Belgium's new evidence-based COVID-19 policies using hospitalization as a new barometer, acknowledging cases are a meaningless metric. If symptomatic but repeat test on day 5 negative, quarantine reduced to 7 days. People can see as many people as they want by respecting hygiene and distancing rules. Belgium has also updated its 6 golden rules to state masks are now only mandatory in crowded places such as transit and cinemas. No limit on max number of guests allowed at a professionally organized event. For events with an audience max of 200 people indoors and 400 people outdoors. And this is in response to a question of why isn't Doug Ford responding in the same way. Here is stunning out of Milwaukee County, and the United States isn't Canada, but this is interesting how this is happening everywhere. The United Kingdom, the United States, Canada, everywhere this is happening. I'm going to show you the first minute or so. Okay, here you go.
Now tonight, there's more scrutiny about just what qualifies as a COVID-19 death as we have passed another very difficult milestone.
Well, last month, the CDC released figures showing the vast majority of people who were listed as dying from COVID-19, 94% of them had other morbidity conditions, on average 2 to 3 other potential causes of death. Now we have numbers from Milwaukee County that may be even more startling. As of this past Sunday, 410 out of the 422 deaths there attributed to COVID-19 occurred in patients with other underlying potentially deadly health conditions. That's 97% suffering from diabetes, heart disease, leukemia, colon and prostate cancer, and more. Most had 2 to 3 conditions. Some had 5 or 6 serious illnesses, but all of them were listed as COVID-19 deaths. Even if they weren't tested for the coronavirus, if they had symptoms, that was their listed cause of death. And COVID was never named a secondary cause or cause other. It was always the primary cause. Here's one example. Cause A, coronavirus. Cause other, heart failure, diabetes, Parkinson's, cardiovascular disease, renal failure. Remember, that's one patient. But in Milwaukee, per the medical...
410 out of 422 deaths. It might have been the Parkinson's, or maybe, the diabetes, or the heart failure. Coronavirus. Coronavirus, says Chrystia Freeland. Here's from September 24th. Today is September 24th. CBC says, public health officials call for tighter restrictions, warn COVID-19 can spiral out of control. Fear. Watch for the death numbers. Infectious disease experts say Canadian health authorities must tighten restrictions again, or hospitalizations and death from COVID-19 will increase exponentially in the coming weeks. Echoing comments made Tuesday by Chief Public Health Officer Dr. Theresa Tam, who said Canada is at a crossroads in its pandemic battle, experts in public health are urging governments to take decisive action to prevent the current resurgence of the virus from spiraling out of control. Canada's reported 1,248 new cases Wednesday, and on Tuesday, the country's most populous province, Ontario, reported its highest number of new cases since early May. Tam outlined projections that show new cases could climb to 5,000 per day by October if we continued on the current course. To date, we're not moving fast enough to get ahead of things. Dr. Michael Gardam, an infectious disease physician based at a women's college hospital in Toronto, I think we're being lulled into a false sense of security because of the low numbers of hospitalizations and deaths relative to earlier in the pandemic. But they will come in the next 6 weeks or so. Yeah. So I wonder what Dr. Michael Gardam's price was to come in and say that to the Toronto Star. I wonder how much, he got paid, right? The deaths aren't just like low. They're next to non-existent. Like you have more of a chance of being shot by a wayward bullet in Toronto than getting and dying of coronavirus. Like, it is irresponsible. We haven't had a death since August 28th. And before that, it was August 13th. And before that, it was July 28th. I think. July 28th or 30th. One or the other. But still, long delays between deaths. Even with the crazy, if you die with coronavirus, you get to be a coronavirus death. Welcome to statistics, right? The Toronto Health was talking about, right here, right? Individuals who have died with coronavirus, but not because of coronavirus, corona death. And they're so sure that they scrubbed their data numbers here. So, I mean, that's news in and of itself, right? Unless I've missed it. Please do link to the chart if you can find that chart. There's every likelihood that I've made a mistake and there's nothing insidious happening, but maybe, who knows? Did you know that there's private clinics for MPs? Don't we have universal healthcare? Isn't it like everybody gets the same healthcare? No? Okay. Here's CTV Power Play. Why did Aaron O'Toole use the private clinic for MPs after he was turned away at a public walk-in? This is frankly the NDP and Liberals trying to make hay out of the situation, said Michelle Rempel. Make hay. And Ali says, a better question would be, why is there a private clinic for MPs? How do I get into this private clinic? Do I have to be an MP? Can I just buy my way in? You know, like citizenship in Canada, right? There's enough money. You can get into that. No problem. From New Brunswick's recovery plan, green phased. Even after this is all over, and they still plan on making masks part of the new normal. This is why it's imperative that we don't give them an inch now. It's social conditioning from the government. This is from the Don't Wear a Mask, and this is from the this is, as Brett says, from the working document. And the green area, it says, the transition to the new normal includes the reopening of all businesses and activities with increased health and safety practices remaining part of daily life. All conditions lifted with the exception of community face masks, facial covering, which remain required to wear in public when ill. When ill, who gets to define when you're ill, right? If the COVID boogeyman is around, it's like a Schrodinger's cat, right? You're always ill until you have a negative test. And then as soon as you go anywhere, your test is invalid. Why did I get this? How much was this? Why did I do this? What is the doctor going to do? I have COVID-19, doctor. I've tested positive. Can you help me? Oh, I'm afraid I can't because I'm not allowed to prescribe hydroxychloroquine for you and zinc. So go home and drink some water and tell me if it continues to get worse. That's all they can do. So why test? To inflate the numbers for the government? Why test? Here is the PCR tests have a high false positive rate. So this is Sky News. Some people don't like Sky News. I don't know. I used to watch Sky News when I would go visit my family. Foreign Secretary Dominic Raab says the challenge with testing for COVID-19 in airports is the very high false positive rate, and adds only 7% of tests will be successful in identifying those who have the virus. 7%. Why are we testing? Why is anybody doing this? What are they going to do for you if you test positive? Oh, you win! You win! What do I win? Yay! Great! Are you going to help me with my sickness? No, you win 14 days in your house. You better not go out, or I'm going to fine you $5,000. See you later. Here's the Sky News.
There has been a campaign via, I think, the Daily Telegraph newspaper, where the former Prime Minister, even the former Prime Minister, said that you should improve testing at airports, or indeed put testing in at airports, and we don't. Why not?
The challenge is that the false positive rate is very high. So only 7% of tests will be successful in identifying those that actually have the virus. So the truth is you can't just rely on that. And in fairness, I don't think those advocating it think that you can. You'd still have to rely on the self-isolation at home and have further testing
5
there.
days later, but why not do that?
Well, actually, that's what we have. We have self-isolation at home, and we want to make sure we ramp up the testing capacity to alleviate that and other measures. But the truth is, with test and trace, and there'll be, we've made huge gains over the last few months. We are prioritising key workers on the front line, NHS workers, care home workers. We've got our testing rate per capita is ahead of any other major country, ahead of all the other European.
If only 7%, it's only 7% accurate. It's 93% inaccurate. What use is the test? It's completely useless. We've got all sorts of tests ready to go. Right, everybody stand up here and flip a coin. Everybody with tails, you're positive. Sorry about that. See you later. Like, what in the world? That was a very bad Boris Johnson, mixed with whoever this guy was. I apologize. But what in the world are we doing? Seriously. Opening up Shoppers Drug Mart tests for asymptomatic people? Crazy. In partnership, Christine Elliott, the Minister of Health and Deputy Premier, says, in partnership with Shoppers Drug Mart, Rexall and independent pharmacies, we're expanding access to publicly funded COVID-19 testing in pharmacies. Beginning this Friday, select pharmacies will be providing testing for Ontarians with no COVID-19 symptoms. Why? Testing populations with low COVID yields high false positives.
You know, I think a lot of people think that testing is going to really solve the whole problem, and it isn't. It's one component of a response. If you test somebody today, you only know if they're infected today. And in fact, if you're testing in a population that doesn't have very much COVID, you'll get false positives almost half the time. That is, the person actually doesn't have COVID, they have something else, they may have nothing. So it will just complicate the picture.
Yeah. So why are we using this useless test? Why are we using the useless metric of cases increasing? Why are we going to lockdowns when that doesn't even work to solve this problem? Why are we not even measuring the deaths publicly anymore? Scrub that, because annoying YouTubers point out the fact that we haven't had a death in a while. It is very frustrating. They are pulling the wool over our eyes, and we're either letting them or there is no mechanism to hold these people accountable. But this is unbelievable. Tam's model said we were going to have 350,000 dead, and she's dead wrong. Dead wrong. And now she's saying that we could end up with all these people dead and we're supposed to believe it? Bullshit. Excuse my French. Absolute garbage. I don't believe any of it. These people are shysters at best and criminals at worst. Well, maybe not even worst. But they're lying. They're lying writ large, and they're ignoring very, very inconvenient facts to maintain political power, and it is not appropriate. Thanks for watching, everybody. I'm going to keep doing my videos. I don't care how much they dislike it. Check out CanadaPoly.com, check out CanadaReport.co, and have a wonderful, wonderful day.